living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Worldwide, about 50 million people have dementia, and there are nearly 10 million new cases every year. As studies continue, we're learning more about the effects of dementia and how we might prevent it. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we're going to talk about dementia and steps we can take toward prevention. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. Joining us today is Dr. Nicole Clark from St. Peter's Health in Helena, Montana, and she's a neurologist here today to talk to us about dementia and dementia prevention. And thanks so much for being here today, Dr. Clark.
Thanks for having me.
Oh, it's our pleasure for sure. We appreciate your time. So let's start at a high level and just begin by defining what dementia is.
Sure. Dementia just means a progressive memory loss. So it's a really broad term. We have this horrible connotation about dementia, but it just is a broad term meaning something has caused progressive memory problems. It's not something you just woke up with one day, but it may have progressed over weeks or months or years.
And so is dementia categorized as a disease or a group of symptoms, or what is it categorized as?
So dementia itself is the symptoms of losing memory. So it's really a symptom, but but dementia can be many different diseases that can cause dementia. And these are things like Alzheimer's, frontotemporal dementia, Lewy body dementia, vascular dementia, even traumatic brain injuries. And all of those things can cause that progressive memory loss found in dementia.
Okay, great. And I would love to talk about a few of those diseases here in just a moment. But first, we all kind of have some memory issues as we get older. How is dementia different than what just happens with the normal aging process with our brain?
Sure. Just dementia in general, it can be different for different people. And it's certainly different depending on what has caused that memory loss. But in general, you have more difficulty with day-to-day tasks. For a lot of people, it can start with forgetting where you put your keys, but end up being difficulty remembering who your children are, what their names are, trouble doing bills, trouble remembering where you're going while you're driving. All of those can be symptoms.
Do we know whether these symptoms or dementia has a specific cause?
We know some of the causes of dementias. For instance, sometimes when you have dementia due to several strokes, we know what the cause is often. But sometimes we have diseases that cause a progressive memory loss or dementia. And unfortunately, we really don't know the reason. Things like Alzheimer's disease, we don't know what causes that to happen yet.
Okay, and let's talk about Alzheimer's. So how is Alzheimer's related to dementia?
So Alzheimer's is a type of dementia. If you think of it, Alzheimer's is our umbrella that covers all of the categories, including Alzheimer's is one type of dementia. So it's kind of a subcategory.
And then you mentioned some other types of dementia. Let's talk about those too. Vascular dementia, what is that?
So vascular dementia means trouble with the blood vessels, usually in small strokes that can be either the capillaries or the bigger blood vessels. And multiple strokes cause damage to multiple parts of your brain, and over time can lead to memory loss.
Okay, and you also mentioned frontotemporal dementia. Can you talk about that one a little bit?
Sure. That one is, let's say, a cousin to Alzheimer's disease, and it affects a little different part of your brain. It affects the frontal lobes more than the back part of your brain, the parietal lobes. So frontotemporal dementia looks a little bit different. Typically, people with frontotemporal dementia or FTD would have more trouble with impulse control and making decisions and what we call executive functioning.
And I've also heard Lewy body dementia. What is that one?
Lewy body dementia is actually the second most common type of dementia after Alzheimer's disease. And it is a cousin to Parkinson's. So very oftentimes when we see that people have the motor symptoms of Parkinson's, like a tremor or shuffling when they walk, and memory problems on top of it, then that makes us question a Lewy body dementia.
So when it comes to diagnosing these, how does a healthcare provider or you as a specialist and neurologist go about determining what type of dementia a person might have?
Sure. There are lots of tests we can use, and unfortunately, none of them are just wonderful. We don't have any blood tests yet, or what we would call biomarkers that give us really clear yes, no answers about Alzheimer's or frontotemporal dementia or Lewy body. But we have some tests. Mainly we use MRIs to look at the brain and look for areas of atrophy or shrinking, look for strokes, some other signs. And we do some more in-depth memory testing, often called a cognitive evaluation, that can help focus in where the problems are and can tell us which type of dementia we're dealing with.
So we're coming up on a break here in just a little bit here, Dr. Clark, but really quickly, are there things that I, as a loved one or a family member, can look for with symptoms to see if someone might be developing dementia?
Sure. Things to look for are, it is progressive. So if you find that, 6 months ago, mom could handle her own finances, but now she can't control her own checkbook, or can't follow a recipe, or had called because she got lost going to the grocery store and didn't know where she was at or how to get home. Those are big red flags that would indicate further testing.
Okay. All right. Great. Thank you. We do need to pause here for just a quick break, but when we come back, we're going to talk about dementia and possible ways that we may prevent it. Stay with us. We'll be right back. Welcome back to Healthy Living for Life. We're still talking with Dr. Nicole Clark, who is a neurologist with St. Peter's Health, and thanks for sticking around with us, Dr. Clark.
Thank you.
So we've talked about the symptoms and how we might recognize that dementia is developing or progressing, but what are some of the, barriers or issues that we might run into as family members or loved ones who are trying to help someone who may have dementia?
Yes. And as caregivers, I always focus a lot on caregiver techniques when I visit with patients, because one of our biggest concerns is helping the caregivers with their very difficult job. So there are lots of things you can do. There's a lot of support out there. Now with the advent of all of these virtual meetings like we have right now, there are virtual support groups through the Alzheimer's Association, both local and national groups, as well as in-person meetings that can help. There are groups that do respite care and help in caregiving, especially when we get to more severe stages of Alzheimer's or any other dementia that require full-time caregivers to be present.
Okay. So let's talk about prevention. We're going to switch gears a little bit here. And I guess the most obvious question first is, can dementia be prevented?
That's a good question. Usually not, but there are some things you can do to decrease your risks. A lot of people have dementia because they're genetically predetermined, and there's not a lot you can do about that. But there are some things you can do to minimize its impact and slow down the progression and actually decrease your risk of developing a full dementia beyond a mild cognitive impairment somewhat.
Okay, so let's talk about some of those possibilities. And can we start with exercise and how exercise might help slow it down, or on the flip side of that too, how not exercising might increase your risk?
Sure. Well, think about the blood vessels. Blood vessels give you your blood supply, they give oxygen to the brain, and the brain likes to have oxygen. So the more you're exercising, the better your cardiovascular health is, the healthier your brain is going to be. So physical exercise and just getting your blood pumping is very helpful, both before developing dementia in terms of prevention or staving it off, but also when you've been diagnosed. We recommend doing at least 30 minutes 3 times a week. That doesn't have to be strenuous. It doesn't have to be going to the gym and pumping iron. It can be water aerobics classes. It could be going out for a walk. It could be a stationary bicycle. Any of those things that just get your blood pumping are wonderful.
And so getting your blood pumping, that sounds like blood pressure might also play a role in this. Can you talk about, watching your blood pressure? Is that something you would recommend as well?
Sure. Specifically, people more with a vascular dementia, controlling your blood pressure, which is often, if your blood pressure is that out of control, you often need medications. But exercising, not smoking, controlling your blood pressure, taking any blood pressure medications that have been prescribed will decrease any vascular damage, and primarily will help those patients with a vascular dementia to keep it from progressing any further.
And so you mentioned smoking. Can you talk a little bit more about how smoking might increase your risk?
Sure. Back to vascular dementia is the bigger risk. Having strokes, even having these small lesions that are called white matter disease, that both of those can lead to a dementia. But also we have found that smoking increases the prevalence of Alzheimer's disease and that development. So if you quit smoking, it can lower your chance of dementia in the future.
Okay, great. And what about if you've already been diagnosed? Doing those kind of things are also quitting smoking, taking your blood pressure medicine, those all help if you've already been diagnosed with dementia as well?
Certainly. It can help decrease the progression of it. It probably will not give you that memory and that functioning back once you've lost it, but it can slow down the progression so that you're doing better a year from now, 2 years from now, 5 years from now, and it's not progressing as quickly and letting you go downhill.
Okay, and I know a lot of people have talked about brain games or ways you can train your brain. Do those help? And if so, what would you recommend?
Mm-hmm. I always talk to my patients about staying mentally active. And there are some programs out there that you can pay for and do computer games or things on your tablet. And those are fine, but they haven't been shown to be any more effective than just staying mentally active. So you don't have to pay for a special subscription. Just do whatever interests you. That could be crossword puzzles, Sudoku, reading the newspaper, discussing current events, music, things that aren't just sitting in front of daytime TV zoning out, really.
Okay.
Anything that you feel like engages your brain and becomes mentally interesting to you is going to help keep you sharp.
Okay, great. We do need to take another break here quickly, but when we come back, we're going to talk more about some steps we can take to stave off or prevent dementia with Dr. Clark. We'll be right back after these messages. Stay with us. Welcome back. We're talking with Dr. Nicole Clark, who is a neurologist, and we're going to continue talking about some steps that we might take to prevent dementia. Dr. Clark, and let's talk about diet. Are there certain foods we can eat or should avoid that might help stave off dementia?
As far as diet goes, just a well-balanced diet that would be heart healthy is going to be brain healthy. There aren't really any specific supplements or things that you need to eat. Just to keep a well-balanced diet is important to keep you healthy.
Okay, great. And then you said supplements. Would you recommend certain vitamins or supplements or not so much?
I really wouldn't. There are lots of things out there on the market that say they will protect your memory, and they cost a lot of money and have no proof behind them. Unfortunately, there is no magic substance that's going to protect you. It really is a matter of staying as healthy as you can and staying as mentally active as you can.
Okay. Great. I've also heard that there might be a link between people who have hearing issues, especially if they don't wear their hearing aids, and developing dementia symptoms. Can you speak to that a little bit?
Sure. We call it hearing loss is a very common cause of what we would call pseudo-dementia or a false dementia. So a lot of people, when they can't hear, seem to have dementia. They can't remember because they haven't really heard the information in the first place. And if it doesn't go in, it's not going to come back out. So hearing loss and also depression and anxiety can commonly cause the appearance of a dementia without actual damage to your brain. So that is sometimes things that we talk about in clinic, and we want to make sure if you do have some memory loss that we address any sort of hearing loss and any potential depression or anxiety to kind of take those possible causes off the table.
Okay. And then lastly, as far as prevention goes, I just wanted to touch on sleep and what role sleep might play when it comes to trying to maintain brain health and stave off dementia.
Sure. Sleep is very important, and also treating any obstructive sleep apnea or using a CPAP if you need one is very important and helps tremendously in day-to-day functioning and developing dementia.
Okay, and as we get older, is there a recommendation on how much sleep we should be getting?
It's different for different people, usually 6 to 8 hours. However, some people need more sleep and some people don't need quite that much.
Okay, so whatever works for you, it sounds like, so you don't feel tired.
Yes.
Okay, perfect. So let's switch gears now from prevention and start talking about some treatments. What are some of the new treatments that people who have been diagnosed with dementia might be able to receive or that are being talked about?
Sure. So there are some really exciting medications that have come out just this year, and there's been a lot of hype about them. You've probably seen them on TV. There's a lot of excitement. And in general, most of us as neurologists look at them a little bit skeptically, and frankly, a little bit disappointed in the results. We're not there yet. It's very exciting. We've learned a lot about potential causes of Alzheimer's disease. And I think we're going in the right direction with these medications, and we're going to see some more developments over the next several years and better medications coming out. For right now, these medications are talking about potentially slowing down progression by about 30%, which is pretty good, but have to be in people who have mild to preclinical Alzheimer's disease, which is really difficult to catch. So for people who are really already having trouble getting lost or wandering or safety concerns, that they're already in a moderate dementia, they're not going to be helped by this medication. So the medication, the newer medications, we kind of take with a grain of salt. We're not quite there yet. They certainly will be good for some people, and they're going to be they're a great step in the right direction. We still do have some older medications that can slow down progression. That would be Aricept or donepezil, Namenda or memantine. Those are the two common medications. Those still slow down the progression. They don't stop, they don't reverse anything, but they're helpful. So it's still worth getting that assessment. We don't have a magic cure yet, but if you have concerns, look into it. Go get some testing done. See if there is something like an atypical depression, a hearing loss that can be reversed. Or is this something that we can put a halt to, or at least slow down, because those options are available.
Okay, great. We're almost out of time. In a sentence or two, any closing thoughts, either on prevention or on treatment?
I would stress again, care of the caregivers, and that all the caregivers out there who may be watching this need to take care of themselves.
Very good advice, and that's so true. Thank you very much, Dr. Clark. We appreciate your time and your expertise this morning. And thank you so much for joining us. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week. Thanks, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.